Hematology. Adult medicine. Hematology. I. Anemia. 2. Leukemia. 3. Bone marrow. 4. Bleeding disorders. V. Myeloproliferative disorders. Anemia. A. Microcytic, iron deficiency. Anemia. Bleeding, loss of iron, decrease intake, nutrition, increased iron requirement, pregnant, breastfeeding. Clinical features: headache, pica, restless leg syndrome, hair loss. Investigation: FBE, low MCV, MCH, MCHC. Low ferritin, most useful, low serum iron, high TIBC, high transferrin. Gastroscopy, coloscopy. Treatment: iron therapy. Ferrous sulfate. Severe, 4 iron. B. Microcytic, thalassemia. Mutation on the alpha globin, chrome 16, OT globin, chrome 11. Common, Mediterranean, Middle East, tropical Africa, c. Clinical features: headache, pica, restless leg syndrome, hair loss. Investigation: FBE, low MCV, MCH, MCHC. PBS, plus, target cells. Iron studies, normal serum electrophoresis. Treatment: alpha, folic acid supplementation, lifelong transfusion, iron chelation, desferrioxamine, BM transplant. HBH, blood transfusion. C. Microcytic, sickle cell disease. Globin gene mutation, Gluriteward Aroval, autosomal recessive vaso-occlusive disease. Trigger, dehydration, infection, hypoxia. Investigation: hemolytic anemia. Inc. reticulocyte count. PBS, irreversibly sickle cells, plus, target cells. HB electrophoresis, HBS. Complications: splenic infarct / sequestration, painful crisis, vaso-occlusion, dactylitis, priapism, acute chest syndrome, avascular necrosis. Autosplenectomy. Risk for infection of encapsulated organisms, PBS, plus, Howell-Jolly bodies. Treatment: pain, morphine, patient-controlled analgesia, PCA. Hydration: hydroxyurea if with infection, thergencephalos. D. Normocytic, anemia of chronic disease. Causes: inflammation, infection, tissue injury, malignancy, RA, SLE, CKD. Investigation: FBE, normocytic anemia. Low ferritin. Treatment: treat underlying cause. If high risk for thrombosis, EPO. E. Normocytic, anemia of kidney disease due to failure of EPO production and reduced RBC survival. Investigation: FBE, normal MCV, MCH. Iron studies, normal low reticulocyte count. Treatment: CKD, EPO symptomatic and hemoglobin 10G/DL blood transfusion. F. Macrocytic, VIT. B12 deficiency. Pernicious anemia association, Crohn's disease. Sources: animal products. Causes: atrophic gastritis, H. pylori, H2 receptor blocker, PPI, chronic alcoholism, strict vegan diet. Clinical features: anorexia, weight loss, diarrhea, glossitis, angular chylosis, jaundice. Polyneuropathy. Investigation: FBE, high MCV, greater than 100, PBS, plus, oval macrocytes, anisopoikilocytosis. Serum cobalamin, low, 148, serum MMA, high serum homocysteine, high if antibody test, plus. Treatment B12 IM oral B12 plus folate 5 mg per day. Low serum iron. Low TIBC high transferrin. Macrocytic, folate deficiency causes malnutrition, malabsorption, drugs, methotrexate, TMP, phenytoin, increased requirement, pregnancy. Clinical features, like B12 deficiency, anorexia, weight loss, diarrhea, glossitis, angular chylosis, jaundice. No neurologic symptoms. Investigation FBE, high MCV, greater than 100, PBS, plus, oval macrocysts, anisopoikilocytosis. Serum folate, low serum MMA, norma, serum homocysteine, high. Treatment oral folate 5 mg per day for 4-MO plus /B12 supplement. Anemia quick table. Leukemia A. Acute myeloid leukemia, AML, adult, 60 yo, risk factors DXT, malaise plus pallor plus oral problems, gingival hypertrophy, stomatitis, gingivitis. Investigation FBS, pancytopenia, 30% myeloblasts. PBS, plus, our rods, plus, MPS. Treatment all-trans retinoic acid, ATRA. Chronic myeloid leukemia, CML, adults, 20 to 50 yo, Philadelphia chromosome T, 9, 22, BCRABL gene. Blast crisis, XL and transformation to AML or all. Clinical features, fatigue, fever, abdominal fullness. Splenomegaly, sternal tenderness. Investigation FBS, leukemoid reaction greater than 50,000, shift to the left, metamyelocytes, myelocyte S, 5% blasts. PBS, hypercellular marrow, high EOS, high BASO. RT-PCR, FISH, plus, low LAP. Treatment imatinib, dasatinib, grablotyrosine kinase inhibitors. See acute lymphoblastic leukemia, all, children, adults, worse prognosis, association W/Down syndrome T, 12, 21, good prognosis. Clinical features, anemia, persistent tiredness, dizziness, paleness, or sob when physically active. Frequent or repeated infections and slow healing. Increased or unexplained bleeding or bruising. Bone and / or joint pain. Investigation FBS, 25% myeloblasts, PBS, plus, condensed chromatin. MPS. Treatment chemotherapy HSCT. D. Chronic lymphoblastic leukemia, CLL, MC. Adult leukemia, MW. Often asymptomatic features, constitutional, malaise, fever, weight loss, night sweats. Lymphadenopathy, neck, axilla, groin. Hepatosplenomegaly. Investigation FBS, AIHA, low PLT PBS, plus, smudge cell CD20 plus, CD23 plus, CD5 plus. Treatment indolent CLL, observe FCR regimen, fludarabine, cyclophosphamide, rituximab. Three bone marrow aplastic anemia due to failure of myeloid stem cells, radiation drugs, benzene viruses, EBV, HIV, hepatitis Fanconi idiopathic. Clinical features. fatigue, malaise, purpura, pallor, mucosal bleed, petechiae, infection. Investigation FBE, pancytopenia, PBS, normal morphology BMA, hypocellular W/fatty infilled low reticulocyte count high EPO. Treatment: withdraw offending agent HSCT, immunosuppressive agents. Myelodysplastic syndrome, pre-leukemia, refractory anemia, high risk for developing AML onset, 70 Yo clinical features: anemia, fatigue, weakness, dyspnea, pallor, splenomegaly. Investigation FBE, anemia, pancytopenia PBS, macrocytosis, large PLT, hypopigmented neutrophils, plus, Dowell bodies. BMA, cytogenic studies, fish normal B12, folate. Treatment: low risk, observe high risk, HSCT hypomethylating agent, decitabine. ATG, cyclosporin. RBC transfusion with iron chelation. Hemolytic anemia, a hereditary spherocytosis defect in proteins interacting with RBC membrane skeleton, ankyrin, band 3, protein 4.2, spectrin. Clinical features: splenomegaly. Gallstones, aplastic crisis with parvovirus B19 infection. Investigation FBE, high MCHC, N, MCV PBS, plus, spherocytes, plus, OFT. Treatment: if severe, splenectomy. G6PD deficiency, MC enzymatic disorder of RBC X-link recessive inheritance, PPT by drugs, infections, fava-bean sulfa drugs, anti-malaria, TMPSMX nitrofurantoin. Clinical features: usually asymptomatic malaise, weakness, ABD pain, jaundice, hemoglobinuria. Investigation FBE, hemoglobinemia, normocytic normochromic. PBS, plus, Heinz bodies, bite cells, anisocytosis, spherocytes. High LDH, B1, low haptoglob. Treatment: avoid triggers, blood transfusion for severe anemia. ARF, HD. C. Paroxysmal nocturnal hemoglobinuria, acquired mutation in PIGA gene causing decrease RBC protection. Clinical features: anemia plus dark morning urine. Investigation flow cytometry, CD55/59DXT, Coombs, hemolytic anemia, pancytopenia, venous thrombosis. Treatment: eculizumab BMT. Bleeding disorders: A. Hemophilia, intrinsic pathway inherited, X-linked recessive hemophilia A, factor VIII hemophilia B, factor IX. Clinical features: hemarthrosis, easy bruising. Investigation PTT, prolonged PT, normal platelet count, normal bleeding time, normal low factor VIII or IX. Treatment: A, DAB plus factor VIII CONCB, factor IX concentrate. Immune thrombocytopenia, ITP, idiopathic thrombocytopenic purpura, acquired disorder, immune-mediated destruction of platelets and inhibition of platelet release from megakaryocytes. Acute, children, post-infectious, self-limited. Chronic, adult secondary, SLE, HIV, HCV. Clinical features: mucocutaneous bleeding, oral, GI, repro. Investigation FBE, low platelet count, large platelet, normal morphology. BT, increased BMA, Inc. megakaryocytes. Check secondary causes. Treatment: steroids, immunoglobulin therapy. Refractory, rituximab, splenectomy. Observe, bleeding, PLT greater than 30. Thrombocytopenic purpura, TTP, inhibition of ADAMTS13, increase platelet adhesion, then thrombosis. Clinical features: fever, MAHA, renal failure, neurologic symptoms. Investigation: FBE, anemia, low platelet PBS, schistocytes, fragmented RBCs, polychromasia, NRBCS. PTT, normal PT, normal platelet count, low bleeding time, increased high B1, retic, low haptoglobin. Treatment: plasmapheresis steroids. Hemolytic uremic syndrome, HUS, triad, acute renal failure plus MAHA plus thrombocytopenia. Children, post-infectious, E. coli 0157H7. Clinically like TTP. Clinical features: fever, MAHA, renal failure, neurologic symptoms. Investigation: FBE, anemia, low platelet PBS, schistocytes, fragmented RBCs, polychromasia, NRBCS. PTT, normal PT, normal platelet count, low bleeding time, increased high B1, retic, low haptoglobin. Treatment: plasmapheresis supportive. Atypical HUS, congenital, not preceded by a diarrheal illness. TX, eculizumab. Von Willebrand disease, VWD, autosomal dominant VW, binding for factor VIII, for platelet adhesion. Intrinsic pathway defect in platelet plug formation. Clinical features: mucosal bleeding, bruising, epistaxis, menorrhagia. Investigation: PTT, prolonged PT, normal platelet count, normal bleeding time, increased, plus, VWF antigen. Treatment: DAP. Coagulation cascade. Myeloproliferative disorders: A. polycythemia vera, PV, high RBCs, intense itching after warm shower, erythromelalgia, severe, burning pain, plethora, low EPO. Treatment: phlebotomy, hydroxyurea, JAK1/2 inhibitor. Essential thrombocytosis: proliferation of megakaryocytes and platelets. Suspected when PLT greater than 600,000 on 2 exa, 1 month apart, without secondary causes. Causes: IDA, infection, inflammation. Clinical features: bleeding, thrombosis, erythromelalgia. Investigation: FBS, PLT greater than 600,000 PBS, PLT large ABN morphology. Treatment: thromboembolic risk low, observe high, hydroxyurea plus low dose aspirin.